Hello everybody, this is Monica Heltz with your daily Fishers Health Department update. First of all, if you were tested July 27th or after, we know that you are still awaiting your results, and we continue to push our community lab partner to troubleshoot these issues to the best of their ability. So some of the things that they can troubleshoot is that they are using a new process that we hope will improve the turnaround times. They assure us it will improve the turnaround times. So we'll be continuing to look forward to that. One of the things that they cannot control right now and that we cannot control is a national supply chain issue of a testing reagent that they need in order to figure out if you're positive or negative. So this is a really critical factor in our ability to respond nationally to this pandemic. And quite frankly, I am very just as upset as you might be waiting for your results. I am equally upset that this is still an issue at this point in the game. This was an issue early on in the pandemic, and I had hoped that these issues had been kind of thought through and resolved by now, but clearly they have not been. So again, this is a national issue, not a local issue. This is not unique to Fishers. We've seen a lot of our hospital partners have to change their criteria to who they're testing. They're only now offering testing to symptomatic people in order to preserve the reagent for the people that need it most. So we have decided to handle it at Fishers by continuing to offer our test to everyone, but that means we have to wait for the longer turnaround time with our community lab partner. So there's two ways to handle this, but we've taken the approach to continue to offer the test to our asymptomatic individuals. If you're symptomatic, you could consider going to one of our hospital partners that is offering the test for people with symptoms, and you will probably have a faster turnaround time. So believe me, we want to contact you, and we're standing by and waiting and ready to follow up on any positive reports that we get. We know that it is frustrating, and we know that the response is more effective the sooner that we can give it, and we're ready to do that. But national supply chain issues, unfortunately, are a bit out of our reach. So please know that we also want you to interpret the last 7 days of our graphs on our community dashboard with some caution. Even though it looks like it's a downward trend, those numbers will continue to backfill as we get reports in, and Eileen, our epidemiologist, has helpfully highlighted those in a lighter blue color so that you know that that's kind of the caution zone on interpretation. If you want to deep dive into that dashboard, her post yesterday should give you that, and she'll continue to do those every week. Some other things I wanted to cover were a couple of metrics. So one that gets talked about a lot is a percent positivity rate. This is a really great measure of the people that we're testing, how many of them are positive. So if we test 100 people and 10 of them are positive, our positivity rate is 10%. This is a metric that's used in a lot of the guidelines and recommendations for how we know when it's safe to open or when we need to shut things down. This was used, I think, early on in the pandemic as justification for closing everything down. This is also something that the schools have cited as a metric that they wanted to use, and that some other states have recommended for different purposes. It's an important measure, but it is also important to note that this is not the only measure that we use. For example, the reason that we don't hang our hats on one measure and why we look at more things than just that are because, an example is our testing supply chain issue. So if we know that institutions like hospitals are triaging who they're testing and they are now only testing symptomatic individuals, then we know that our positivity rate is going to go up because the chances of finding positives in that smaller set of people who are more likely to be positive is going to be higher. So this is similar to what we saw early in the outbreak, where the positivity rates were like 30% because we were only testing people who were strongly symptomatic and nobody else could get a test. So neither of these situations is ideal. Neither the triaging your patients or having a long testing turnaround time. These are not ideal scenarios. But this highlights why we can't take one measure in isolation. So one of the other measures we look at is our case rate, or the number of cases we're getting. on any given day. So Fishers has a population of close to 100,000 people, so this can be easily correlated to a standard case rate, which is a measure of cases in 100,000 people. So if you look at our community data dashboard, you can roughly get at our case rate based on just the number of cases that we get in a day. This is a helpful tool to tell us how many contact tracers we need to have available to follow up on disease. It tells us how many people are walking around in the community with this disease, and cumulatively over time, it tells us how many people have been affected by the disease. So all of these are kind of important indicators, but they have to be taken in context. So the case rate, we have to take in context of the number of people we're testing. The percent positivity, we have to take in context of, are we testing everybody? So all of these are only two examples of metrics that we look at. We also want to know, how is our testing turnaround time? What is our contact tracing turnaround time? And then some other things that we might look at are, what is our hospitalization rates? Are we starting to see ER visits going up? What's our ICU capacity and our ventilator capacity? Some of these are more important at a regional level than they are at a local, like city level. But these are all things that have to be taken into account when we talk about community metrics and what kind of recommendations we make from a community standpoint. So just things I want you guys to take into consideration as we move forward, that again, there are reasons why we don't use only one metric when we talk about these things. The metrics are important. They're really helpful guides, but it's important to take them in context and not use them in isolation. So we'll continue to give you these daily updates. Thanks so much for listening. Have a good day. Bye.